Recent comments by the U.S. president are sparking debate around whether there is an end in sight for the pandemic. In a Sunday episode of CBS's 60 Minutes, Joe Biden acknowledged that there is a problem when it comes to COVID-19, but he believes the pandemic is over. However, the U.S. continues to see about 400 deaths per day due to the virus. Following the message, White House officials quickly clarified that the comments did not mean a change in policy. But Mr. Biden is not alone in his optimism, with the director of the WHO recently suggesting that the end of the pandemic is in sight. Well, this comes as restrictions continue to be lifted in Canada, and life seems to be returning to a pre-pandemic normal. But with flu season ahead of us, just how comfortable should we be amid the ongoing pandemic? Joining us now to talk more on this is Dr. Abhishek Raut, medical director at Appletree Medical Group. Dr. Raut, welcome back.
Pleasure to be here.
So let's start with this, Dr. Raut. What is the current state of the pandemic in Canada?
Well, in the last 24 hours, we've had about 4,000 cases across the country. Now, keep in mind, in the beginning of August, we were seeing about 20,000 cases a day, and in April, close to 60,000 cases a day. So quite an improvement there. We continue to have COVID deaths. About 21 people died from COVID-19 in Canada in the last 24 hours. And in total, Canada has suffered around 45,000 deaths from the COVID-19 pandemic. From a prevention perspective, 31 million of us, or about 83% of Canadians, are fully vaccinated, which is much higher than the worldwide number of about 63%.
Now, if we go to Mr. Biden's interview for CBS's 60 Minutes, he was pointing to fewer people wearing masks. And right now, we can see social distancing being less of a concern in society. So is this indicative of the end of the pandemic, Dr. Raut, or are we heading toward another wave?
Well, I think both of your points of view there are actually right. The WHO also agrees that we're coming close to the end of the pandemic, and we're starting to see a lot of COVID-19 measures being gradually dropped. But I don't think that means the end of some waves. I think we're going to see a lot of them come and go, and it's quite natural to see these ebbs and flows with virus infections. I think we're definitely going to see another spike around Christmas and the holidays, but the important thing there is to make sure we're still vigilant when things worsen.
And meanwhile, we know flu season is coming up. So how will influenza impact the pandemic this fall and winter, doctor?
That's a great question. Now, remember, pre-COVID, influenza was the cause of death for about 7,000 Canadians a year. So that's still a number we'd like to decrease considerably. But here's what I've seen so far. Many people in Toronto are still wearing masks. Many are still social distancing and trying to avoid these larger crowds. So the net effect of this is we're going to see, hopefully, a lower transmission of colds and influenza during the fall and winter. So I'm cautiously optimistic that this change is going to really make a difference in terms of reducing the number of influenza cases and COVID-19.
All right, Dr. Well, a lot of experts say the COVID-19 virus will stay with us for some years to come. So what does the end of the pandemic look like?
That's an interesting question because the WHO has a very formal way of determining the end of a pandemic. It's done it about 6 times since 2007 for influenza, polio, twice for Ebola, as well as Zika and monkeypox. But really, it's an 18-member committee of experts who look at the data points like mortality rates, vaccine rates, and determine whether the pandemic has ended. So interestingly, there isn't a hard data point, but more of a scientific consensus.
All right, Dr. Raut. Now, we're also learning about the impacts of a long COVID. So can you tell us a little bit more about what we know so far about it and how you see this condition being treated in the coming years? Will this be a crisis within itself?
Right. I think this is going to be a huge challenge for us to face. So what we know is with long COVID, we have fatigue, memory deficits, shortness of breath, sleep problems, and joint pains. Those are the 5 most commonly observed symptoms there. So I really hope that health ministries, both federally and provincially, will have a very targeted approach to at least these 5 issues. We're going to really need to see teams and funding for long COVID clinics where a group of healthcare workers can really effectively provide relief for patients who are suffering these symptoms.
All right, Dr. Raut, about a minute left here, but what can Canadians do to stay safe while enjoying the upcoming fall and winter seasons and the festivities that come with them?
Well, Nima, in the coming months, we're going to see a lot of diversity of reasons to gather, including Rosh Hashanah, Diwali, Halloween, Christmas, and many others. So these are really times for Canadians to deeply connect with families and friends. The pandemic is slowly coming to an end, but it's not there yet. So with that in mind, I still recommend some caution. A quick rapid test before a big event or a family gathering is still a great way to keep our loved ones safe.
Always a helpful interview. Dr. Raut, thank you again for your time today.
Thanks so much for having me.